Hello and welcome to another video of this course. This is module 6 of the Personal Health and Hygiene course. We're going to be looking at physical activity and hygiene in this module, and under that we'll look at the benefits of physical activity. We'll be looking at we'll be looking at physical activity and hygiene. We'll be looking at types of physical activity. We'll be looking at hygiene practices in physical activity, common hygiene issues in sports and exercise, and consequences of poor hygiene. Physical activity refers to any bodily movement produced by skeletal muscles that require energy expenditure. It includes walking, running, jumping, dancing, swimming, and even house chores. It is different from exercise, which is a planned, structured form of physical activity. What are the various types of physical activity? Physical activity can be broadly categorized into aerobic, muscle strengthening, bone strengthening, balance, and flexibility activities. So we'll be looking at each of these types of physical activity one after the other, starting with aerobic exercises. Aerobic exercise, also known as cardiovascular or cardio, includes anything that gets you breathing and your heart rate up. Aerobic exercises can help improve blood pressure, cholesterol, and sleep. Now, aerobic exercises can be grouped into low, moderate, or vigorous intensity based on how much they increase the breathing and heart rate. Low intensity activities. If you can talk and think during an activity, you're exercising at a low intensity. While great for any age or fitness level, low intensity exercises can be particularly beneficial for beginners, older adults, and people with joint pains or those recovering from injuries. Examples of low intensity activities include leisure walking, light swimming, vacuuming, mopping, and other house cleaning activities. We have moderate intensity activities. Moderate intensity activities are activities that can get your heart pumping. And during these activities, you'll be able to talk, but you won't be able to sing. Examples of moderate intensity activities include swimming or water aerobics, jumping, walking, dancing, and leisure biking. Now, vigorous intensity activities. These are activities that will leave you out of breath and you'll be only able to string a few words together at a time. And this type of vigorous intensity activities include running or biking at a fast pace, swimming laps, or doing very heavy work such as digging, shoveling, playing basketball, tennis, or jump rope. Now we have strengthening exercises. Now, like aerobic exercises, muscle strengthening exercises are also essential. These activities or exercises can help maintain muscle and bone mass and are an important part of healthy aging. Women particularly can benefit from strengthening activities as bone and muscle loss are common during and after menopause. Some examples include lifting weights, working with resistance bands, doing push-ups or sit-ups, doing heavy yard work or gardening, and doing some form of yoga. Now we have flexibility exercises. These are movements that help with your flexibility. They can help to prevent injury, reduce body aches, and increase the range of motion. Examples of flexibility exercises include stretching, yoga, Pilates, and Tai Chi. We have balance exercises. Maintaining good balance can help prevent falls and injuries in older adults and is important for everyday activities such as walking or climbing stairs. Some balancing exercises include walking heel to toe, standing on one foot, then repeating with the other, yoga, tai chi, standing up from a seated position. Now let's look at hygiene practices in physical activity. We already know that hygiene refers to habits and practices that maintain health and prevent illnesses. In physical activities, involves keeping the body, the clothes, environment, and equipment clean before, during, and after exercise. Now, let's look at some of these hygiene practices. They include washing the hands. Like we already said, you should wash your hands for at least 20 seconds and shower at home before and after any physical activity. People should also cover their mouth and nose with a tissue or bent elbow when coughing and sneezing, and also immediately dispose of used tissues in a bin and wash their hands after. We also have equipment hygiene. Ensure that your equipment are clean. Wipe them, especially if there are areas that touch the skin, with a disinfectant, wipes, or spray before and after use. Another practice is avoid sharing equipment. People should not touch other people's personal items such as towels, water bottles, or mobile phones. And this includes personal sports equipment such as tennis rackets. Clean and cover wounds. You should also use a disposable towel. Now, what's the importance of hygiene in physical activity? Hygiene is crucial because it can help to prevent injury, it helps stop the spread of germs and reduces the risk of infections and skin issues. But let's look at them one by one. It can help to prevent infections. How? Germs can spread easily through sweaty gear, shared equipment, body contact, and high touch areas in facilities like locker rooms and bathrooms. Practicing good hygiene helps prevent the spread of germs and reduces the risk of contracting infections. It can also help in reducing skin issues. Skin infections, which can range from viral to fungal to bacterial, can result from poor hygiene. So, maintaining clean skin and hair, trimming nails, and avoiding shaving or exfoliating before training can minimize the risk of skin problems. It's also important because it helps us maintain overall health. We can maintain hygiene in facilities such as gyms, locker rooms, bathrooms, and showers. Now, what are common hygiene issues in physical activities? Common issues in physical activities include skin infections like arthritis foot and ringworm, as well as the spread of germs and illnesses through shared equipment and body contact. Poor hygiene can lead to unpleasant odors, discomfort, and potentially serious health issues. So let us look at these issues. Number one, we have skin infections. Skin infections include ringworm, arthritis foot, and penicillin-resistant Staphylococcus aureus. So ringworm is a fungal infection that develops on the top layer of the skin, and symptoms include itchy, circular red rash with healthy skin in the center. We also have arthritis foot. It is a related fungal infection that can cause problems on moist areas of the foot and between toes. Symptoms include itching, burning, and stinging. Now, for the Staphylococcus aureus is a type of staph bacteria that causes serious skin infection and is resistant to many antibiotics. The symptoms include painful boils and crystals that are red, swollen, and contain pus or other fluid. Now, we also have respiratory infections, and under that, we have influenza and human rhinovirus. Influenza is a contagious respiratory illness caused by influenza virus. Elderly people, children, pregnant women, and individuals with compromised immune systems are most at risk. The symptoms of influenza include fever, cough, runny nose, sore throat, body aches, headache, fatigue, and in some people, diarrhea and vomiting. The virus is spread by inhalation or infected airborne droplets and after touching the face following contact with contaminated surfaces. Human rhinovirus are a common group of viruses that cause the common cold. The infection grows in temperatures between 91 and 95 degrees Fahrenheit, making the nose a prime breeding ground. The symptoms may include runny nose, sore throat, cough, sneezing, and congestion. Now, we also have gastrointestinal infections, just like the norovirus. Noroviruses are an extremely contagious group of virus that cause acute gastroenteritis in humans. The symptoms include acute or onset vomiting, watery diarrhea, abdominal cramps, and nausea within 12 to 48 hours of contracting the illness. Now, another common issue is body odor. Body odor is during physical activities, a common occurrence due to the breakdown of sweat by bacteria on the skin. Sweat itself does not smell, but when it is mixed with bacteria, it can produce an odor and is especially noticeable in areas like the armpits where there are more apocrine sweat glands that produce thicker, milky sweat. Now, what are the consequences of poor hygiene? Poor hygiene can lead to a range of negative consequences, including health problems, social isolation, and even economic impact. These consequences can affect individuals, communities, and even entire society. So we'll look at the consequences based on those categories. Health consequences. We have infections. Poor hygiene increases the risk of contracting various infections, including colds, flu, scabies, athletics, foods, diarrhea, and food poisoning. It can lead to dental problems when you have poor dental hygiene. You can have parasitic infections like head lice and body lice, and it increases the risk of chronic diseases because studies suggest that there's a link between poor hygiene and an increased risk of chronic diseases like diabetes and dementia. Now, some social and psychological consequences, include social isolation. Poor hygiene can lead to social rejection, bullying, and low self-esteem. It can also lead to mental health issues because in some cases, poor hygiene can contribute to a worsening mental health problems. Economic consequences include increased healthcare costs because treating illnesses caused by poor hygiene can lead to higher healthcare costs for the individuals and society. We also have loss of productivity. Poor hygiene can lead to absenteeism from work, school, and it can result in lost productivity and economic losses. And finally, it can damage one's reputation. For businesses, poor hygiene can damage their reputation and lead to a loss of customers. So thank you for watching this video. We will see in the next video where we'll be learning about sleep hygiene. Bye for now.